Should I use this one or I can tap this one? Yeah, that's all right. Hi, everyone, and this is a great pleasure to have this opportunity to present preliminary result of our household transmission of Omicron, and we had that opportunity to do this transmission study during Omicron when it just developed in New Zealand. And, the pandemic, one of the characteristics of the COVID-19 was the facing different variant of this virus. And then Omicron started to develop in New Zealand early 2022. And because we had that infrastructure as the household study SHIVERS-I, we decided to run this household transmission study. And better than me, the household is a core for a study of transmissibility of the virus. Therefore, it was important for us to just set up such a sub-cohort within our big household study to see what's going to be the factors affected the transmissibility of the virus, and identify especially some kind of the emphasis on the vaccine and some demographic factors and also behavioral risk factors. And this analysis is a part of that recently funded project by MOH as the under aim 2, and then as I just mentioned earlier, our aim is just to calculate secondary attack rate and to see what's the potential risk factors in terms of demographic and also some underlying condition, for example, vaccine history and some other factors related to these dynamics. Again, this is just, probably I can skip this slide. In terms of design, this is the sub-cohort within SHIVERS-I study, and Sue explained about that study this morning very well. Study time, we started the season because of the Omicron start. At that time, it was early February and all the way of September 2022. The catchment area is like a SHIVERS-I based on Wellington and Upper Hutt DHB and CCDHB. In that place, we just running that one. We recruited a total number of 75 households with the total number of 306 participants altogether. In terms of data collection, once we receive ARI-related PCR confirmed positive COVID, our clinical team contact that participant and ask them about whether they are interested to join to the household study. If so, they just started to approach them in details. First, they just collected some data, kind of questionnaire related to exposure, how the symptoms start, when it start, and some kind of place they've been exposure, and all of these details about the index case to verify the primary case. And then ask them about the rest of the family composition and ask them to join the study. I just put this behavioral risk factor there. I'm just talking in the end of this slide about that questionnaire. And then all of the household members required to do swabbing every third day until the 2 consecutive negative swab from the last positive COVID in that family just come negative, and then we stop swabbing that family. And also at the same time, they receive kind of the symptom tracking up to 28 days to just report us about their daily symptoms, and it was about the ARI. And also 4 to 7 weeks after the first swabs, they should do the blood sample in the end of the study. And also when the family monitoring all process just done, we had an interviewer to call them and set up a interview about some details about some behaviors during the course of infection, whether they're wearing, for example, masks, whether they're sharing plates, bedrooms, and some kind of the all hygiene things related to infection. But I didn't have time to just look at that big data set, and I'm pretty sure we can just extract some good data related to transmissibility of the virus within, especially that low socioeconomic, or based on low socioeconomic, for example, composition compared to higher socioeconomic things. But unfortunately, the time was so limited for that analysis. Index case in this study was the first PCR positive COVID-19 in that family. The secondary case was any family member got positive within 2 to 14 days after the first case confirmed by clinical team. And also that PCR confirmed by the lab technicians. And then we have some specific demographics and vaccine history definition here. This is kind of the socioeconomic. We use just that kind of the proxy for socioeconomic. This is the area-based kind of the calculation based on census data. And I really appreciate Professor June Atkinson for providing that information to me. And then we use prioritized ethnicity in New Zealand. We have Maori, Pacific Asian, and New Zealand, European, and other kind of ethnicity all together. But for the purpose of this study, because the total number of the household just was small, I just, again, I should just collapse some of the categories to show some results for this presentation. And the vaccine history, it was just unvaccinated, 1 dose, 2 doses, and booster. We just small number had the second booster in this study, and then they just not included in the analysis because they just done their second booster within 14 days all the way of onset of disease. Therefore, we exclude them from the analysis. And for the data analysis, we just first calculate secondary attack rate, and then based on that secondary attack rate based on some demographic and vaccine history, and then also divided that one based on the index characteristics, index case characteristic, and also the household contact characteristic. It means we have 2 different tables to show what potential risk factor going to be in terms of transmissibility of the virus. And then we just calculate serial interval. And at this stage, as I told you, because of the time limit, it's just the classic Poisson regression I used to show the results, and perhaps later on we're going to do some kind of the more advanced modeling to see the relationship kind of the things in the analysis. This is the first table to show you the characteristics of the household based on the index case and also based on the household contact, whether they got infected or they just not infected. 90 participants just not infected from the household members, and 141 they just secondary attacks, and also 75 index cases you can see here. And also, as you can see in terms of the age group, one interesting thing is the majority of index cases, they come from the age group 5 to 18 years of age. And also in terms of the vaccine history, you can see we have some unvaccinated index cases and also incomplete vaccination we just consider as the 1 dose. And I should tell you the majority of these groups as the unvaccinated and 1 doses, they just are children, because the rollout for the vaccine in New Zealand is just different with the adults one, and then the teenagers They just started very late to get vaccinated. And also we have quite a good number of index cases come from the low socioeconomic. As you can see, one quintile is the highest socioeconomic, and all the way of 5 is just the lowest socioeconomic group. Not much differences between the ethnicity groups. And this is the graph to show you the serial interval of Omicron in this particular household study. The median interval was just 6 days, and the mean was 5.9. The thing I should say, we had few cases, just kind of the negative numbers. I just not included in this calculation now because I need to assess them in details to verify whether that kind of report for onset is just clearly been before the onset of the index case. Therefore, probably you can see a little bit just longer kind of the days for the onset of the disease in the household contacts. And this is just the still need more assessment. And this table is just interesting in terms of this is the secondary attack rate based on the index case age, for example, socioeconomic and vaccine history. As you can see, and this in the last column, you can see the age and vaccine adjusted output. Therefore, we're just not worried about those things in the analysis. And you can see as the age increased, the older age, 50 plus, a little bit higher risk of the transmissibility. You can see when the index case is older one, but I can't tell you this is just kind of the very kind of verified results because the number of those index case in 50 plus is not too many to just jump to conclusion and say this is if the index case older, therefore the transmissibility is higher. But we can see a little bit, increase in that group. But the interesting result is about the vaccine doses. If you can see, as long as the index case got 2 doses or 3 doses of vaccine, the risk of transmissibility from that index case decreased. It means this is the effect of vaccination on transmission study. And another interesting result going to be about the NZDEP or socioeconomic, those coming from lower socioeconomic index exposed index cases. Those just reported a higher transmissibility. And then this is just perhaps indicates some of the kind of the behavior risk factor. I need to just have a look in details based on those questionnaire in the end of a study. We just have a look whether their behavior is during the infection period was different with the families, with the kind of higher socioeconomic group. And then another thing, this is just, we can see a pattern. The secondary attack rate increased as long as the crowding increased in the family. Therefore, this is also going to be an interesting place to see about the behaviors within those crowded family. Sorry, I'm just really in the end. This is just one slide. And I found it interesting to make some clusters. If the index case is unvaccinated, here unvaccinated definition including both 0 and 1 dose vaccine together as the incomplete vaccination and unvaccinated together, the real unvaccinated. And the cluster of unvaccinated index unvaccinated contact, and then this cluster compared with the vaccinated index and vaccinated contacts as a reference. And you can see it's a very nice pattern. Those cluster unvaccinated, both index and contacts, has a higher risk of getting infection. And this perhaps implies some kind of the indication for the importance of vaccination. And still, we need to just have more kind of the detailed analysis in this case. And I can tell you again, the majority, they are children. And I'm just skip this slide because I talk about that. And the further analysis, because of we would like to see the behavior risk factors alongside with this kind of analysis we've got, and also thanks to our lab people, we have the viral load now, and then it's a very, very good area to look at the viral load, duration of disease, and also the effect of the vaccination all together as a part of the the demographic and those information I provided earlier. Hopefully, soon we can just provide a better analysis for this study, but the only thing is just the number of the families wasn't too high, and it was just kind of it was very, very good setup, and I really appreciate our excellent SHIVERS team to just manage do that study. However, it's just this is what we have at the moment, and still we have some good information to conclude based on that. Thank you so much, and that's it. It's time.